So mobilization for the posterior inferior aspect of the shoulder. We're going to have a cuff weight underneath the scapula to stabilize it. We're going to pre-position in flexion, and there's two different methods we can do. The first method, which is a little easier for a male therapist, I'm going to grasp the distal aspect of the patient's forearm. I'm going to place my hand in a supinated position, and I'm following from the coracoid process to the posterior acromion. I'm coming in, relax for me, and this is a curved glide. As I glide, I'm oscillating, and then I'm pulling across into crossed adduction. As the patient improves, I can come up a little bit higher, and you can feel now there's more tension on the capsule. So this is one method to help mobilize the posterior inferior capsule. Okay. The second method, if you're a female therapist, is I'm coming in. Now I'm going to stabilize, relax for me. He's going to relax, and I'm going to stabilize. I'm going to use the patient's elbow to come across. This time my hand is in a pronated position. I'm following the line between coracoid process and posterior acromion, going posterior slightly, superior slightly lateral. I am oscillating into the grade 3 mobilization as I'm coming into crossed adduction. So I oscillate as I'm coming across. I can come up a little bit higher to add a little bit more stretch. I follow up with some neuromuscular reeducation where I'm coming in, I'm keeping him in an abducted position. I like to place my hand behind to help stabilize, and I want him now, we're going to start with first passive, then active assistive internal rotation. So go ahead, keep that shoulder blade pushed down into my hand. Good, and then I'm going to ask him to internally rotate. But I don't want to see that anterior scapular tilting. So even if it's a very short arc of motion, I would rather have that to start getting subscapularis kicked in and minimize the pec contribution. So push back into my hand. Good, and then I'm going to have you internally rotate. That's it, good. So you can do passive, then you can do active assistive. And this is very difficult for him, but this is a good way to start working on that neuromuscular control. Good.